right, you back? You ready to go? All right, chapter 16, part 2, coming in at it. Remember last time in the video that you probably just watched, or you might have watched within the last couple of days, we covered, let's see, what did we cover? We started talking about marginal benefit. We started discussing public goods, what it means to be excludable, what it means to be rival. After this, we're going to start talking a little bit about sort of the voting system, a little bit, and then we're going to talk about public good provisions and allocation of resources, and then we're going to go just a teeny bit into healthcare. So let me go ahead. We're going to share the screen. It's over there. All right. So when we're providing public goods, there's a couple things that we have to take into account, right? First is going to be the marginal social cost of the public good. Now, remember what we had done previously is we started talking about the marginal social benefit. So if I'm thinking about a public good, maybe I'm willing to pay $100 for a fire truck in Edwardsville, and you're maybe willing to pay $50, and they're willing to pay $20, and they're willing to pay $10. All of our marginal benefits together for that one fire truck represents what the marginal benefit price-wise of that one fire truck would be. Marginal social cost is fairly similar, right? It's the idea that the social cost, so private cost is the cost to just me. Social cost is I'm making a decision and it's how the entire society is affected. Okay, so maybe just throwing my pollution into the river, that would cost me $100 because I got to pay for the truck to get there. So it's $100. But maybe if we start thinking about the people that live on the river, it costs house one $50 in damages, and house two $100 in damages, and house three $300 in damages. All of these costs together, that's our marginal social cost from a public good. So it's that similar horizontal summation, but for cost instead of benefit. So it's determined about the same way, right? The efficient quantity of a public good is going to be where this marginal social benefit equals our marginal social cost. So remember, the efficient quantity of a private good, that's where my benefit equals my cost. For a public good, it's where society's benefit equals society's cost. Oops. All right, so let's think about what that means, right? Let's say that we have our downward sloping marginal social benefits curve. This is one that's created in a similar way that what we saw earlier when we were putting together Lisa and Max's marginal social benefit. Then we have an upward sloping marginal social cost curve. So this is going to be the cost of one more of something. For example, one more firefighting plane is going to cost the city so much money. A second firefighting plane, that's going to cost the city so much money. It's probably going to start getting a little bit more expensive, right? Because we're going to have to go from further to order them. We're going to have to get more expensive ones. There's less ones available. They're going to have to be shipped in from wider places, right? So marginal social cost, the cost of one more fire truck and the maintenance and the upkeep and everything else, that's going to go up. Well, our marginal social benefit's going to go down. For every fire truck or firefighting plane that Edwardsville has, we only get so much benefit from it. The fourth firefighting plane does not bring us as much joy as the first one did. So what if we're over here? What if we have less than our marginal social, or marginal social cost equals marginal social benefits? So we look at these two together, that equals about 3. The number of airplanes at 3 equal about what we want. Well, let's say we're at 1. Well, if we're at 1, we see that there's a really high benefit for that first plane and a really low cost for the first plane. The first one's not that pricey in upkeep and everything else. So maybe if my marginal social benefit, this blue line right here, exceeds the marginal social cost, this line right here, well, then I'm going to want more. I'm like, well, my benefit's way more than my cost, so why don't I just order another one? And then I go to 2. And I see that my benefit's still above my cost. I'm like, oh, okay, well, that means I'm getting even more happiness from one more. Let's get another one. And maybe I get 3. I notice that they're equal. I stop at this point because there's no more marginal social benefit to be gained. Let's go the other direction. Let's say that because if we had 1 or 2, this is under provision, right? And if we equal exactly, this is where the socially efficient quantity would be. But let's say we're all the way over here. Let's say that we're on airplane number 5. Well, airplane number 5 is really, really, really expensive. And remember, Lisa doesn't even want airplane number 5. She gets no benefit. And then Max gets a little bit of benefit. So society's benefit, the marginal social benefit, is actually going to be really low compared to the cost. But what do we do in that case? We say, well, this is way more costly than the actual benefit we're getting from it. Let's reduce. We're going to have one less. Okay, so we go from 5 and then we go to 4. Well, at 4, the cost is still way higher than the benefit that I get. So I'm like, you know what? Let's go down to 3 because this is costing me more than what I'm getting from it. We go down to 3. Eventually, we get back to the sufficient quantity where our marginal social cost equals our marginal social benefit. We never want to leave that spot. We're very happy there because society is just as well off in their benefit as they are in what it actually costs them to get these planes. So we're very, very happy at an efficient quantity of 3 where the marginal social cost equals the marginal social benefit. Now, there's this idea of inefficient private provision. When the town of Edwardsville got together to buy firefighting airplanes, well, then we were able to gauge the benefit based off of what everybody would benefit. I put in a little bit with my taxes. My neighbor puts in a little bit with their taxes. You might put in a little bit of your taxes. And then the government, together with all those funds that are roughly equal to people's benefit, they're able to purchase the plane. But private provision is not the same, right? If I went to you and I said, hey, the only way that we're getting a firefighting plane in Edwardsville is if you pay for it out of your pocket, we're not getting it, right? If they come to me and say the only way we're getting a firefighting plane in Edwardsville is if you pay for it out of your pocket, I'm like, I only make $100 of a benefit. Of course I'm not paying for your plane. So there's an inefficient private provision. The private firms or the private individuals would actually have a very small number of firefighting planes because they're so expensive. And if we have one, they're a public good, right? It's non-rivalrous, so I can still use it if someone else is using it. And if they buy it, they can't exclude me, right? If the town's on fire and they put out the fire, they can't say, oh, well, you didn't pay for the plane. So why would I want to pay for the plane? So there's an inefficient private provision because private firms and private people just won't buy firefighting airplanes for the town of Edwardsville. But there might be an efficient public provision. If we, and these are strong assumptions, right? If we can determine what everybody's value is, and we can determine very accurately what the marginal cost is going to be. So we have a very, very good idea of people's benefits and their cost. Then if we have a system that can go around and gauge everyone's benefits and then charge them similar to what their benefits are and use that money to buy the plane, well, then we can get a more efficient provision. Instead of having 0 planes, we might get closer to that 3 planes where society's happier, right? Because government can tax these consumers near what their provision would be. It overcomes this sort of free rider problem if we manage to force everyone to pay what their benefit's going to be. If I'm going to benefit from this plane by so much and they force me to pay it through a tax or charge, then if everybody's doing that, then there's enough money for a plane and then they buy a nearly efficient number of planes, right? Now, let's say that we have 2 political systems that are fighting against each other, or well, maybe not necessarily fighting against each other, but they're on opposite sides of the plane argument, right? They're like, oh, firefighting planes in Edwardsville. That's poppycock. We don't need any of that. Well, there might be another group that's just like, yeah, we totally need all of that. We do not like the idea of fires. We want all the planes, just like all the planes, right? So we might have 2 different groups, one that wants no planes and one that wants a lot of planes, right? So that means that these groups might propose different levels. One might propose us buying no planes, while other might propose that we buy all the planes. But the thing is, society's benefits kind of in the middle, right? We would like there to actually be just a few planes. We don't want all the planes and we don't want none of the planes. We're actually best off if there's some planes. So we have to think about what that looks like. So let's say that we have some very hopeful people. Because we're gonna have 2 political parties. We're gonna call them hopes and fears. Hopeful people are very hopeful that we're not actually going to need any of these planes, right? So they're like, you know what, we don't need any planes. We would prefer probably 0 planes. We don't need planes. We're very hopeful Edwardsville's not going to catch on fire. Then let's say that we have the fearful side, or the fear political party. And they're like, we are definitely going to have a fire. We need all of the planes, every single one of them. We really, really need the planes, right? So we have no planes and all planes. Hopes, fears. Hopeful about not having fires. Fearful we're going to have fires. All right, so what happens in that situation? Well, let's say that the hopeful people, they're like, we don't really need 3 planes. We're not going to catch on fire. Instead, we're going to propose, you know, because we would like votes, we're going to propose that we are going to get 2 planes. We're going to get 2 planes. All right, so that's what they end up proposing. The fearful ones are like, We actually think that there might be a higher chance of fire than a lot of you are expecting. We're going to propose 4 planes. We won't vote, so we're proposing that we buy 4 planes. So we have one political party's plan and then the other political party's plan. Notice that neither one of these are at what the efficient allocation of planes would be for this town, right? So they're not going to win votes. Well, if Hope's like, I'm not actually where society wants to be, so I might not get the votes. They might actually go to the fear party. So what should I do? Maybe I should up the number of planes, be a little bit closer to what that social equilibrium is. So maybe instead of 2 planes, because I want to win votes, I want to be closer to the middle, because if I'm closer to the middle, then that's about what society wants. They're more likely to vote for me. So I'm going to propose 3 planes now. Okay, so I'm going to increase up to 3 planes. That's the hope side. Well, let's think about the fear side. Let's say fear's like, we really think that there's going to be fires, and we really think we need at least 4 planes. But if we keep saying 4 planes, they're not going to vote for us. They're going to vote for the hopeful people because they're going to cost them less money. So maybe we should also be closer to the marginal social cost and the marginal social benefit where they're equal. We should be closer to that efficient quantity. So you know what? We would like 4 planes, but 3 planes is better than 0 planes. So we're going to reduce the number of planes that we say we need, and we're going to tell people that we also want 3 planes. Well, now all of a sudden we have hope, who has changed to be closer to where society is, and fear that has changed to be closer to where society is. And now both of them are proposing, hey, 3 planes. And then they just end up splitting the votes. This is the idea of the principle of minimum differentiation. We see this not only in political parties, but we also see this, well, ideally see this in political parties over long periods of time. So maybe not the most recent changes, but maybe just overall. And then we also can see this in private markets. So there might be a political party who's like, yeah, firefighting airplanes. And another one that's like, no, firefighting airplanes. And they'll eventually get closer and closer together because they realize that society wants one level. So the closer their policies are to that level, the more votes that they're going to get. So they eventually come closer and closer. We call this the principle of minimum differentiation. Eventually, their plans are going to look really similar. We also see this in the private sector, right? Why does McDonald's, Burger King, Wendy's, Jack in the Box, Freddy's, why do they all have a hamburger, fries, and a drink on their menu? Every single one of them. It's because of the principle of minimum differentiation. They figured out that that's about what society wants. So even if one of them really wants to not do burgers, or one of them only wants to do quadruple decker burgers, they realize like that's not exactly what people want. So they eventually come to what the demand is. The demand is for a burgers, drink, and fries. So all of them are going to offer burgers, drinks, and fries. Like they're a little different. They might taste a little different. And they might cost slightly different and come in different packaging, but they're all just kind of getting closer and closer of like having very similar items in all their menus, right? This is the idea of principle of minimum differentiation. If they want customers and they know that customers have this one social level that they want, they're going to get closer to it. So that's kind of an interesting thing, right? So inefficiencies can come in 2 forms. One is the idea of overproduction. We're making too much of something, more than what society wants. And then we have underproduction. We're actually not producing as much as what people want. First, let's talk about inefficient public overprovision. So this is when the government or a public entity provides too much of something. So let's say we have this competition between the 2 political parties. So the hopeful about planes are fires, and we don't need the planes, and the fearful about fire, so we need all the planes. Well, they eventually will kind of come together to compete, and they will provide about the efficient level of the public goods. But that's elected officials, right? These are the people who want votes, so they're more likely to come to wherever that agreement is because they want people to vote for them, or companies come to this agreement because they want people to shop there. But remember, we have, when I was giving you the circle earlier, we have 2 different types that are on the supply side. We have politicians and we have bureaucrats. Politicians are elected. Bureaucrats are appointed, or they just apply for jobs and get it or not, right? Well, bureaucrats, they're not dependent on getting votes. So you don't vote for who our Parks and Recs department director is. You don't, right? They get there because they're appointed to be there or because they applied for the job and they do a good job. So they want to maximize their department's budget, right? Maybe the Parks Department in Edwardsville really wants a good budget. They just had that like event raising money for the watershed. The watershed's this cool like park that actually used to be just like an abandoned sewage center, and then like they turned it into a nature preserve for pollinators, and it's really pretty. If you haven't gotten a chance, go down there. So they might want lots of money because they're trying to make new accessible equipment and new accessible trails down there, which is really nice and awesome of them, right? So they want to maximize their budget, which might be above the amount that people actually want. Maybe if we think about our benefits from the watershed, maybe they want more money for the watershed than what everybody's benefits from these projects would be. Or in the idea of the firefighting planes, the people in the planes department would definitely like more planes. So they're going to be like, yeah, you know what? I want to maximize my budget. We need a couple extra $1 million for planes, even if that may not necessarily be what people want, right? So sometimes bureaucracy leads it so that politicians provide more than what the efficient quantity is because they push to have larger budgets than what might actually be necessary, right? And then there's the idea of rational ignorance. So we see this all the time in voting. A lot of the time when people go and vote, they don't go every year, even though we totally have elections every year, by the way, but then they might pay attention to different things differently, right? They definitely know who's going for president, so they have some informed idea of that, and vice president, and maybe they know a bit about the mayor, right? And about the police chief, but maybe they're not necessarily as worried about who the Edwardsville coroner is, or maybe they're not as worried about like a lot of the very small warden spots for the town, like the Ward 1 person who has to deal with my neighborhood and the Ward 4 person that might deal with another neighborhood. Eventually, there's going to be some decisions that you vote on that maybe it doesn't pay off for you to study, right? Your benefit of knowing exactly what each warden of each of the wards in Edwardsville wants to do, like that's not really going to change your life. And it's going to cost you more researching these people than what the benefit you're going to get out of these people is, or like whoever the city coroner is, spending a lot of time researching that isn't really going to affect your life and make it any better or worse. So you might have this idea of rational ignorance where you decide to not collect information, you decide to not study the coroners, you decide to not study the wardens, and instead you kind of just put down a name, or you decide not to vote on that. Because to acquire all the knowledge about this policy or this provision of a public good or this person, the cost of researching these is more than the benefit you would get. Like the new accessibility routes that they're going to do at the watershed. Spending all the time sitting there and researching what construction companies are they going to get, what rates are they getting, how much asphalt are they depending on to use, what are the price that they're paying for asphalt, well, how much does the maintenance cost over the next 6 years, spending, unless you're me who actually does study those things. But for most people, it doesn't make any sense for you to study that, right? The cost of sitting around reading government documents and spending your day doing that instead of studying for your econ test, which by the way, we have an econ test in like 2 weeks. Your cost for doing that is just going to exceed the benefit that you're going to get from having these cool accessibility trails. So sometimes we just don't study things. We call it rational ignorance. It's where we don't look at policies or politicians because it doesn't matter to us, right? So for voters who consume but don't produce a public good, so I go to the park, but I don't necessarily pay for the park, and I don't necessarily build the park, sometimes it's rational to be ignorant about the cost and benefits. It doesn't really matter to me if Plummer Park costs X number or Y number. It doesn't matter to me if the watershed raises this much money or this much money, right? I just go there and I enjoy the good. For voters who do produce the good, though, it makes sense to be well informed. If I'm the construction guy who's going to be pouring all the asphalt for the accessibility lanes, I'm going to really want to know how much money the city is deciding to give me for this public good, right? Or how much they're willing to pay for me to put down the asphalt. So it makes sense for me to be really well informed. Well, the problem is, this is something that affects lots and lots of people, but the people who will really be advocates for voting, or the people who are most likely to vote, are going to be this one small group who they're paid to build the good. Well, everybody else is just like, we don't really care about the cost. This might end up skewing the amount that we provide to something because not everybody is informed, and therefore we might have an over provision. If the only people who are going to the town hall to complain that we should spend more money on the park are the people who do the construction on the park, well, then we're going to have an over provision of the park. We're going to pay even more for the park because they were the only ones lobbying there, instead of kind of looking at what everybody's preferences would be. That's the idea of, like, on the firefighting planes. Society might be best off with 3 firefighting planes, but when was the last time you looked this up? Before I gave you this video, did you even know that the Boeing plant nearby us made these? Probably not, because it didn't necessarily make sense for you to study it. I mean, you like firefighting planes, yes or no? And you don't really think about exactly how much benefit you get from each one of them. So sometimes bureaucrats will want lots and lots of money in the planes department, but the people who it really affects, you're just like, you know, it'd be cool if we had planes, but I'm not going to spend a lot of time researching exactly how many planes I want. So if we have bureaucrats who know what's going on, and maybe voters who don't really understand their benefit as much, then what we see is we'll have dead weight loss occurring, because we'll have these different groups who are wanting to provide more, right? The planes department will really want us to have 4 planes instead of 3 planes. And the voters are like, we're not really going to sit there and look at the cost and benefits of each and every plane. And we end up having more planes than what might be efficient quantity. We might end up having this over provision in equilibrium. Well, when that happens, if we trace this up, we see that marginal cost is more than marginal benefit. That means a triangle has been created. Whenever you see a triangle, you should automatically think dead weight loss. This is dead weight loss created. This means that we normally have this total surplus if we're at an efficient quantity, but now we're going to have to take this triangle and subtract out this triangle, because this is dead weight loss right here. When we have this dead weight loss, that means that we're losing some of that happiness or some of that benefit that we typically get from good deals. So let's think about healthcare specifically, right? The key reason why government plays a large role in healthcare is because sometimes if we didn't, it'd be underprovided or unfairly distributed. If you let every insurance company be a private insurance company, then rates tend to be a little bit higher. And it covers lots and lots of people, like 300, or I guess not 300, about 200 million Americans would have health insurance if it was only private health insurance offered. But that society might be better off if everybody has a level of insurance, so that we don't have rampant flu rates and we don't have sick people on the streets. And society might actually be better off if we had a little bit more than what the private market would offer, right? So we end up having these healthcare market failures. So there's 3 problems that make healthcare a special good that people tend to not necessarily rationalize well, right? First, we don't always understand its benefit. You know how much you pay for a doctor's visit, but you don't really understand how much each of those doctor's visits affect your long-term outcomes and how well off you're going to be moving forward because you went to the doctor once and it really saves you thousands of dollars in medical bills later on, and you may not know that. Also, we tend to underestimate our future needs, right? I think I'm going to be healthy for the next few weeks, but I could break my leg tomorrow, right? Or I could get the flu and get really, really sick. I don't always think about what my future needs are. And us as humans, we tend to underestimate our future needs. We tend to think we're going to be healthier a lot longer than what people would expect. No one really expects to get cancer. No one really expects to get dementia. Even if they do expect it, they don't expect it with the probability or the high level probability that actually exists. So there's a healthcare market failure, because that means when we're looking at our supply and demand, we're not demanding what's actually going to be used by us. We're demanding what we think is going to be used by us, which tends to be an under provision, right? And then there's lots of people who can't necessarily afford the care that they need, even if society would be better off if these people were cared for. So understanding future needs is difficult, right? Especially, we see it all the time with college students. College students essentially think that they're invincible, right? You really don't think about the fact that you might have high blood pressure in a couple of years. You don't think about the fact that you might have diabetes, or that you might end up getting cancer, or you might get into a car wreck and you're unable to walk, or you might get MS. Because you don't have enough information about the future, you don't have enough information to value the benefit of your health care correctly, because you can't project those future expenditures accurately. So many, especially young and healthy people, tend to be very, very optimistic, and they tend to think that the health risks that they face are very minimal. So they tend to undervalue the insurance policies. And when they undervalue the insurance policies, then this means that the demand is going to be less than what the socially optimal demand would be. The socially optimal demand would actually be much higher than what private demand is. And then there's the idea that some people just can't afford the private market, right? If we have a lot of people who are underestimating their need for it, the rates for these policies are going to be kind of high, because the insurance company knows that you're risky, even if you don't know that you're risky. So the prices are going to be higher than what people are willing to pay, which means some people can't afford it, even if society's better off by these people being taken care of, right? Why do we have Social Security and Medicaid for elderly people? Because society's better off when we don't have dying elderly people who are like totally impoverished without any money, right? Society's actually better off not having that. So for many people, the price of health insurance is beyond their ability to pay. We tend to have two groups of people who are unable to afford insurance. This tends to be elderly people, because by that point they stop working, right, or unable to work, or people with long-term health problems. If you have MS, or you have a long-term cancer that's going to take you years, if not your entire life, to resolve, or if you have, for example, I have like this hives issue. I'm going to be living with that for the rest of my life, where I just will always break out into hives. That's why I wear long sleeves. Long-term health problems like that, sometimes that means that you can't necessarily afford the insurance rates that you're expecting. So these also tend to be the people that have the greatest need for health care, and this health care may not necessarily be provided by their employer because it's very expensive for these particular individuals because of their utilization. Most people want these people to have access to affordable health care. It would be nice if everybody who needs health care could have health care, right? Because there's a social benefit to it. If there's people who are not suffering, society's better off, because that means that these people are more likely to be able to go back to work, and they're more likely to be able to go back to work, make wages, and spend money, which is good for the economy, right? So there's actually additional social benefits from healthcare. So there's these kind of the economics of healthcare, right? Because the marginal social benefit of healthcare exceeds the marginal benefit perceived by consumers. So the benefit that I think I have is actually less than what the marginal social benefit is, because none of us really think about what our healthcare utilization is going to be accurately. That means that if we left it completely to the competitive market, which competitive markets do a pretty good job, right? They do a pretty good job for most people. But there's still going to be an underprovision. There's going to be some people on the fringe who can't quite afford it, who don't quite understand their risk, whose society would be better off if they did have it. So there's an underprovision, and this underprovision might be inefficient because society could be better off, and it might be unfair because it could isolate people who are either aged or have long-term health outcome problems. And then we see that we have these underprovisions, right? So by the way, if you enjoy health econ, so I'm a public economist. Everything that we talked about like public goods and stuff, that's what I teach. If you ever take the public classes, they're actually a lot of fun. We play a lot of games, and I have a great time with it. If you're interested in health economics, I am not a health economist, but we do have we have two health economists technically. We have Ari Bellison and we have Marlon Tracy. Marlon Tracy teaches our health econ class most of the time. So if you're ever interested in just learning about healthcare markets, it's a really, really fun econ class, and I would suggest taking it at some point. So, all right, so let's talk about maybe the prices and costs of healthcare, right? So let's say that in thousands of dollars per patient per year, we have a certain amount that patients are going to spend, and then we have the quantity of patients. So demand is kind of determined by our perceived benefit, how much we think we're going to benefit from something. So our marginal benefit curve, that's just kind of our demand, because we demand about what we think we're going, or our willingness to pay, how much we think we're going to benefit. Our supply, this upward sloping marginal social cost curve, that's how much is just going to cost to be able to provide health insurance, right? Or different sorts of cost per year for health. So we have a good idea of the supply, but we don't necessarily have a good idea of the demand, because everybody's kind of underrepresenting how much they're really at risk. So maybe if we just had a demand that was equal to what people perceive their risk to be, then maybe only 0.3 billion patients would be seen by doctors for about $1,700, right? But what if we think about the actual marginal social benefit? So this is the marginal benefit if it's what we think our risk is. I don't think I'm going to be hit by a car tomorrow. I don't think I'm going to get Regina Georged by a bus. But, you know, it could be a possibility. And society kind of knows that, right? The marginal social benefit for everyone's that's actually at the accurate risk instead of our perceived risk might be much higher. That demand curve might actually be shifted outwards for the social benefit as opposed to our private benefit. Well, then that means if we only have 0.3 billion people who we expect to go to the hospital, but our actual demand curve is way up there. Well, if we trace it up to the new line, we notice that there's actually be a lot higher expenditures for these people. This creates a dead weight loss triangle of inefficiencies that are happening because not enough people have health care for what is actually going to be the cost compared to what we perceive the cost to be. So our market quantity is the amount that we would have if we just kind of consider our private consumption and our perception of our health risks. But if we think about what our health risks actually are, we have the efficient quantity. So the efficient quantity might be where this marginal social benefit equals this marginal social cost. It might be that 0.7 billion patients a year go to the hospital for about $2,400. That's more accurate and reflective of what society is. And that's kind of where we want to have insurance rates, to be reflective of what's actually going to happen in society, as opposed to buying them right here, which is just going to be our perceived risk. So therefore, we have a triangle that happens of insurance policies that aren't being written because the people in between this kind of don't think that they're going to need it, right? Which means that there's an unfairness to it. People who receive health care are only the ones who are willing and able to pay for it. And the people who don't receive health care end up bearing this deadweight loss. The deadweight loss is this difference in between the people that do have insurance and the people that like it's socially optimal for them to have insurance. Well, these people in between, they don't have insurance, but they're still going to have this health care cost, which creates a deadweight loss. That deadweight loss is completely borne by the people who don't have insurance, right? And these are the long-term sick. These are the aged individuals who have stopped working so they don't have an income to pay for things. They're the ones who can't necessarily afford health care. Because the market would deliver an inefficient and unfair outcome, because there are people whose society would be better off if they do have health insurance, then we end up having some government intervention and we treat this as a public choice, even if it's technically excludable and rival. So there's also some different options than public choice solutions, right? It's not always the case that like government could step in and say, okay, all right, sure, this is how much healthcare we're providing to people. There's actually alternatives too. So as a public economist, we have lots of things in our toolkit, right? It's not always setting a price level. It's not always setting a quantity level. It's not always putting in a tax or a subsidy. Sometimes there are other things that we can do to help try to get this private provision of healthcare closer to where the actual need of healthcare is. And there's a wide level of public funding. In the United States, we pay for about 48% of healthcare costs through government expenditures. In the United Kingdom, that's 83%. In Canada, it's 70%. But out of all of these countries, though we have a smaller percentage of healthcare that's paid for by the government, we actually have a really, really high government expenditure per person. So if we divide this per person, we actually have much, much higher rates. So different public choices lead to different expenditures. So it might be that we decide to fund less, but we fund the individuals more and not necessarily the hospitals. Or we could be in a different system, such as Canada or the UK, which mostly funds hospitals that also take some of the expenditures for individuals, but then there's no research or development or things like this, right? So we have different options. We could have universal coverage, single payer. That's the idea that there's only one healthcare source. It's typically a government provided healthcare source that they take out taxes to pay for. Or we can have private and government insurance. So you can either get insurance through your job or you can buy it yourself. Or you can get a subsidized insurance rate if you are unable to afford it yourself by going through a government source. This is similar to what we see with the Affordable Care Act and being able to go to healthcare.gov, and if you make less than like $26,000 or something, you can get subsidies, which make it so your healthcare cost is lower. The next one that we can do is subsidizing private insurance. So we can allow the private insurance market to continue and not actually have a government insurance plan at all. But instead what the government does is they go around, and if they see you don't make much money, they hand you like a voucher or a coupon that you can take to, for example, let's say it's a private company or a private insurance company, and maybe they charge $250 for insurance a month. Well, some companies can afford that, and some rich people can afford that. And they're like, yeah, that's a totally worthwhile rate. But a very low income household can't afford that. So what if they could really afford $50 a month? That's what they could afford. Well, the government can come in, and instead of having a government provided healthcare system, they can say, hey, we understand that you can pay $50. We know that this private insurance is $200 or $250. So we're going to give you a coupon for $200. So you can take the $50 you can't afford plus our coupon for $200, where we'll pay it as the government, and then you can give it to this private insurance company for the $250. These are the different sort of options that we have for the economics of healthcare. So I guess I just sort of talked about what each of these were. Universal coverage, single patient. This is the idea that, or this is what it's used in Canada and the UK. This is where everybody's covered, no exception. The government taxes you, and that pays for your healthcare costs, and you end up paying very low rates, right? That ends up making it so that we have some sort of restriction on the amount supplied, but this amount supplied may not be at what the sufficient amount is, so there could still be a deadweight loss with these single payer systems, because maybe some people are forced to have insurance that may not like it, while other people may not have insurance still under some of these situations. Defenders of the system say that the inefficiencies are really small, because even though there's a lot of red tape and people aren't necessarily getting the exact plans that they want, even if they have better understanding of what their healthcare costs are, maybe these small inefficiencies are worth it because everybody has equal access to services. But it's not necessarily true that everyone has equal access to services, right? Some people will be better at playing the game. Some people have good jobs and they can take off work and they can spend lots of time shopping around different doctors and they know the forms really well. Well, there'll be low-income households that maybe can't take off the time to go see a doctor, and they can't wait long periods of time to go see a doctor, and they're going to be confused by the forms. And so there's different inefficiencies, right? Because there's going to be some people who are good at playing the healthcare system and some people that aren't, even if it's a single-payer system. So then we have the idea of the kind of this mix of private insurance and government insurance, and this is what we have in the U.S. right now. So right now, about 43% of our health insurance is private. We have about another 48% that's government, and then 9% of healthcare is actually just paid directly out of pocket. So these are patients that have no insurance whatsoever that just pay cash. That's why we actually have extremely high default rates, because these bills end up being really, really big, because normally hospitals are used to being able to build insurance companies. So they keep the price high so they can build insurance companies and get a high amount back from insurance companies. But that means that if you don't have insurance to go, you still get these really high bills because that's what they expect to be able to get back from insurance. That's why most hospitals expect that people actually default on medical bills. It's like 60-something% of private patients who do not have insurance will default on their medical bills, and that's why the prices are higher for everything. It's because the people who will pay it, they charge more to offset the people that won't pay it. It's a very complicated system, right? So in this, we find that the quantity of healthcare provided is about 1 billion patients a year, about 3 physician visits per year. But sometimes we see that that ends up having another inefficiency, right? So with the single payer, we may have had some amount of patients, but there was an inefficiency that was created because maybe not everyone can get access. In this one, we have all the people who want insurance get insurance, but then we also have a bunch of people who may not have otherwise had insurance or don't really need insurance will still end up getting insurance under the system. So then we have an over provision where there's actually more people seeing doctors, because if we have this system of some private, some government, it turns out people will go to the doctors more often than is actually socially optimal to go to the doctor. Like, you'll go to the doctor for an earache, even if you don't really need to go for an earache. And then we see that there's an overuse of healthcare services in this. So it's a deadweight loss in the other direction. If everybody has insurance, then they go to the doctor a lot more, even when they don't need to. And then healthcare services are being overutilized, which means that they're more expensive. There's a deadweight loss associated with that. And then, so let's think about what this really looks like, right? We see that we have some people who pay out-of-pocket expenditures. We have some people that pay for private insurance expenditures. We have some that are government expenditures. And we add all of these together, we get to a point where our marginal social cost of continuing at this healthcare level is actually more than what our marginal benefit is as private people from what we expect our healthcare utilization is going to be, or what our risk really is. And it turns out that government expenditures is determined by the quantity of care demanded, but not necessarily by fixed budgets. So let's think about voucher systems. I know I'm going through a lot of information very, very quickly. I tend to not have a lot of questions on healthcare on your exam, but these are really important concepts to know, right? So vouchers are the idea of maybe instead of having like a private and government one that might overprovide, or a government only one that might end up underproviding. What if instead I gave everybody voucher coupons, and I give you like, here's vouchers, and you can go, there's 3 for doctor visits. Okay, so I can go to the doctor and I can hand them a voucher. I can go to the doctor again, I can hand them a voucher. Well, maybe I have one left over. Maybe I'll give this to someone else because I don't really need it. Well, when market failures arise because marginal social benefit exceeds the ability and willingness to pay, voucher systems can actually be really useful. They're an interesting concept. A voucher is kind of a token that can be used to buy one of the item. It can buy you one class from a school. It can buy you one doctor's visit from a hospital, things like that, right? Healthcare vouchers could be used to only buy health insurance. So you can go to a health insurance place and you can be like, hey, I have a voucher for $200. And they're like, okay, you can get the $200 plan for your voucher. Or if you pay an additional $50 on top of your voucher, you can get the slightly better plan. And then you get the $250 plan because you could afford $50, and then you get a voucher for $200, and then you get that. So there's actually a bunch of economists right now because health economics is a huge portion of it. There's always a field that's popular. I'm a public economist. That was really popular and cool in the 1970s, but I still do it. Health right now is the really exciting one. Experimental was the one 10 years ago where we just run experiments on undergrads and like see how many games they're willing to play for like a packet of gummy bears and stuff. So then there's environmental, urban economics, social economics, such as like social justice and things. We have law. Anyways. A lot of economists think that voucher systems might actually be a solution to a lot of what this problem is, right? Because vouchers have a bunch of advantages over government providing things or subsidizing this private use. Because vouchers can be used with public production, it can be used with private provision, or it can be a competition. So if you have a voucher that you can either take to go get your government insurance or to go get a private insurance, and you might pay a little bit more, a little bit less, depending. Well, that's really interesting because you can use it in both markets then. It makes it competitive in between the markets. You can also set the total number of vouchers. So for government expenditures, it's really easy for me to figure out my cost. If I give everybody a voucher for $200, I know that the amount that I'm spending on vouchers is 200 times the number that I give out. And I can set that number. I can give it to 1,000 people. I can give it to 15,000 people. I can give it to 2 million. And vouchers spread the public contribution across millions of consumers. So if I get taxes from everyone in the US, then that means that to pay for these vouchers, then everybody pays just a little bit to be able to help a set of people, which actually might be a pretty large set of people. And by giving the power to patients, so we give the power to patients to choose in between their private insurance or government insurance or different levels of private insurance, or they can pay on top of their voucher, or they can get only the amount of their voucher. We give them the ability to get the lowest cost for what their use will be and allow them to make choices on the quality of their service. Because like in the single payer system, if you only have government, you don't get a lot of choices on the quality of your service. You have one. In the private and government together one, you get a lot of choices over quality, but that doesn't necessarily mean everyone can get it, or people might get too much and it might be an over provision. In this case, with a voucher, people are eliciting their own decisions of what their healthcare should be, and they choose in between them. So that's just kind of a really interesting and fascinating thing that I find neat. Like I said, we have Marlon Tracy. If you ever want to talk about health econ, let me know. I will send you that direction. But congratulations, we are 3/4 of the way done with this chapter. So we had chapter 5, 6, this is 16. All we have left is 17, and then we have exam 2. So come by office hours if you have any questions, and I'll talk to you all soon. Have a great one. Bye.